Welcome everyone to our healthy communities portion of the SOAR Summit. Before we get started, I want to thank our sponsors, the Kentucky League of Cities, the Kentucky Association of Counties, the Kentucky Chamber of Commerce, Kentucky Small Business Development Center, Kinetic from Windstream, Connect Humanity, Eastern Telephone and Technologies, King's Daughter Medical System, Indiana, Kentucky, Ohio Regional Council of Carpenters, and the Foundation for a Healthy Kentucky. Without our sponsors, we wouldn't have such an opportunity to share what's happening across the state to implement here in Appalachia, Kentucky. Foundation for a Healthy Kentucky. And with me today, I have Shannon Smith, Vice President for Advocacy with the American Heart Association, Tim Sizemore, who is the chair of the Fitness for Life around Grant County in Kentucky, and McKenzie Fox, who is our Special Projects Coordinator for the Kentucky Horticulture Council. And to get us started today, I want to get you thinking about your communities. And today's presentation is really meant for you to listen in your community's lens. What can you do when you go back home to implement and become change agents in your community for building up stronger and healthier communities from a non-traditional and a traditional style, and making those changes that really can make a difference that a lot of people just aren't sure that what they do small and increment can make big changes. So everybody's got a smartphone, so get that out, and I want you to participate in these two questions. So when the number comes up, this is called Slido. Join Slido, type in that number on your phone, and then answer the question, how walkable do you think your community is? So as you see the answers come up from the audience and your colleagues looking at the walkable community, I want you to think about if you build it, they will come. So right now it's looking like that we're somewhat walkable, which means we have some work to do in creating more space and more opportunity for building out physical activity opportunities, as well as community opportunities to meet your friends, to walk around. And when you understand, as we move through complete streets concepts and reducing obesity and increasing activity, physical activity and nutrition, it's important that we have the upstream approach of how to build walkable communities at the forefront of our policy work and at our local level. And so the next question, what do you think is the biggest driver in childhood obesity in your community? So our panelists are up here seeing your answers, and again, I'm excited to see the diversity of answers, because when we think about the issues, I'm really excited to see that you're all addressing that poverty plays a huge role in childhood obesity in communities, and again, looking at how we're going to prevent childhood obesity, or how we're going to build stronger communities that support good opportunities and access for healthy foods and physical activity, we have to address the upstream issue, which in fact is poverty. And so the next one down, personal choices, we'll talk about if the opportunity to have good choices isn't there, we can't really blame the individual for a poor personal health choice. So again, looking at those two divergent answers, understanding that you can make a difference by supporting and reducing poverty, and then therefore also increases their access to healthier choices. So thank you, getting that going and getting your the mindset going towards walkable communities and what are those driving factors for childhood obesity really sets the stage for the panel up here. And so just understanding where we're going, again, think about your communities. Shannon's going to talk about the policy level and how you build out those policies in your community and the supports that the American Heart does. And then Tim's going to talk about that, how do you get it done? And then McKenzie's going to talk about another focus on access to fresh foods. And so you'll see the flow, and then we'll follow up with a couple of questions and then opportunity for audience interaction. With that, Shannon, I'll let you go. And absolutely.
Welcome. It's so nice to see so many young faces in the crowd. I am Shannon Smith, Vice President of Advocacy for the American Heart Association, and I am thrilled to join you today to talk about policy and how we can better our communities. So the American Heart Association, our advocacy efforts focus in 5 major areas: access to care, tobacco-free, quality systems of care, healthy eating, and active living. In everything that we do at the Heart Association, at the core of our policies, it's about equity and inclusion. Rural health strategies. What are we doing in the rural parts of all communities to better health? At the core of what we are at the Heart Association, it is science-based. It is the foundation of everything that we do. We look at how we increase access, improve healthcare quality, addressing risk factors while always centered around equity. These are if you see the slides up there, those are the buckets of how we categorize where we keep our policies and where we focus every day. What are some of the barriers to access? And we talked about walkable streets, we talked about affordability, we talked about poverty. Well, there are 14% fewer grocery stores in rural Kentucky than other places, so access is a huge deal. 15.8% of the population under age 65 are uninsured. That's a big deal also. Hospitalization rates, 70% higher than the national average. And then you can see that the supply of dentists, 26% lower than the national average. These are all issues about access. And in rural Kentucky, we have access issues. What are these factors that impact our health outcomes? It's life expectancy. We have the higher cancer deaths. We are number 3 in adults that are overweight or obese. I mean, let that sink in for just a minute. Number 3 in Appalachian, Kentucky for being obese or overweight. So the question came up, what do you think the barrier is, or why do you think that is? Affordability is key to accessing healthy foods as families with higher incomes and education have healthier diets. That is based in science and data. It's research driven. We know that poverty plays a huge role in how healthy our communities are. Higher fruits and vegetable prices are associated with higher body mass indexes in young children from low and middle income families. So we know these all also play a big impact in our overall economy health, because if someone is overweight or obese, they have more absenteeism, lower job productivity, lost earnings, and we have our youth that are diminished military ready. I'm not going to read all this slide to you. You can see it up there, but there is a huge link between obesity and cardiovascular disease. And that's not just inactivity. The foods that we put in our body, the way we process them, creates a response that increases the risk for cardiovascular disease. There is equity in nutrition security. So at the American Heart Association, we advocate for new and expanded policies and programs to improve food security, which you'll get to hear quite a bit about, and expanding our SNAP stands for Supplemental Nutrition Assistance Program. We advocate and try to work every year at the legislative level to increase access to that program to families that are in need. Healthy food access. The percent of Kentuckians participating in SNAP today, or in August of 2022, was 12.2%. We need to increase that by double at least. We need a lot more assistance to Kentuckians. and the benefits spent were $81.8 million, and the total SNAP benefits spent in Kentucky during 2022 was $852.9 million. Did I say billion earlier? I meant to say million. So we also have a program that was incredibly beneficial for our Kentucky youth over the pandemic, and that was universal school meals. And that helped so many families be able to afford to feed their families outside of the child's school day. Unfortunately, those protections have been rolled back. So we are urging Congress to take action. You can get your smartphones out again if you like, and you can scan that QR code and text lunch to that number, and you will be asking Congress to pass universal school meals for all children to be covered. Another, obesity raising the risk for cardiovascular disease. We also need to look at, because of that, our access to heart and stroke systems of care. And that means that no matter where you live, you have access to the most appropriate hospital in the most appropriate amount of time, and you are not waiting, or you can't get transferred to the right place. So this also comes down to how do our hospitals talk to our EMS? It's a critical component of access to care. We passed Senate Bill 55, Stroke Systems of Care, and House Bill 512, Heart Hospital Designation, this past legislative session, which will ensure, like I said, no matter your zip code, that you get to the right place at the right time if you are suffering stroke or heart attack. Policies that can increase access to care: self-measure blood pressure control to be covered under Medicaid. Again, that's hypertension control. We know that those that are overweight tend to have a higher degree of high blood pressure. We need it to be easier for individuals to enroll in Medicaid, to get on some sort of health care program. There needs to be appropriations for public health program, and again, funding for all of these. And I think that the meat and potatoes where I was getting with most of this was one of the policies that we worked on in Louisville and currently working on in Lexington, and would love to extend to Eastern Kentucky and Western Kentucky and Northern Kentucky, is access to safe and equitable spaces. You're like, what is that? That means no matter if you are walking, biking, wheelchair, stroller, walker, that you have a safe space to move about your community. So streets are safe, sidewalks are safe. We are creating these green spaces for people to go out and get physical activity. We know that where there are walking trails or sidewalks, people are more physically active. They will take the choice to park further away, or their lunch break, go to a park and enjoy some outside time, which we all know is much better than sitting behind four walls all the time. And I threw this up here just as kind of an overall snapshot, and I would also like to say that we worked with the Foundation for a Healthy Kentucky very closely on a lot of these policies that we've passed. But just in 2022, we were successful in passing 11 policies that specifically target equity and health and access to it. And every single one that we can pass, and every single youth that gets involved, and every single one of you that decide, you know what, I'm going to make this decision today to pursue access to health equity. And what does that mean for you? What does that look like for you? So that's the goal. And then these are just some additional priorities that we're looking at in the upcoming legislative session. And I think with that, I am finished. I would welcome, any of you to join me in Frankfurt, at Allison at Frankfurt, to talk about these or ask any questions. So that's all.
Thank you, Shannon. Tim, before you get started, do you want to do the clicker? Before you get started, Shannon, just a quick question as far as the supporting universal access to meals and complete streets. How do you see that working in rural Kentucky when you know that there's not a lot of sidewalks? We know that there's not a lot of easy access to healthy foods. what do you envision on how that information can be taken back to communities and that out of the box thinking to get that done?
That's a great question. And I grew up in Hazard, Kentucky. I went to U-Pike, graduate of Pikeville, and I know the challenges that transportation, the road system has in Eastern Kentucky. And it's not always feasible to put a sidewalk, down 23 or on the bypass. But what you can do, you can create walking trails, you can create parks, you can have bike paths. There are ways. We have lots of beautiful green space. We need to be accessing those. We need to be addressing those and asking for them. So we need to prioritize where some of our dollars are spent, and those need to be spent on biking trails, walking trails, and access, safe and equitable access for all.
Absolutely. Thank you, Shannon.
Thank you.
And one more question for you. We have some time. When you think about the participation in the supplemental nutrition program, and we think about the access is one piece, but then also the education about the opportunity there and what those dollars can be spent on for access to healthy foods. What is American Heart's thoughts about community interventions to support nutrition education around the SNAP program?
So I know that our health department, they do a fantastic job of educating the community and really try to be out there. But I would say, one beacon would be farmers markets. It's the perfect place, and double up food bucks. So your dollars go further at farmers markets so you can spend on fresh, healthy produce. So for every dollar you get two, double up. And education at those vendors, at those booths, materials out there, how to prepare the food, what to do with the food. Because, we have a backpack food program in my kids' hometown in our school, and we sent honeydew melons home with the kids one day. Some of them had never seen a honeydew melon. What is a honeydew melon? And they loved it. We got so much positive feedback from the honeydew melon. So again, experiencing new things and having those things available and the resources to pay for them.
Great, thank you. So take-home message is, how do you support utilization of foods that your neighbors have never had access to or ever seen before? How do you support that potential education for the foods that are available for them? Thanks, Shannon.
Can I add one more thing? I would also
Sure.
say local, buying local, supporting our farmers, and it's the wheel, right?
Totally
It's the cycle.
ties
So
in.
supporting our
Absolutely.
farmers and into the farmers market. So
All right, so next we'll hear from Tim. Tim, like I said, is the chair of the Flag Coalition in Grant County, and will share with us how building up grassroots opportunities to support some of these policies and changes in your community that Shannon just alluded or talked about. Tim?
Thank you. Welcome, everybody. It's great to be here this morning. This is actually the first time I've actually been able to present some of the things that we're doing in Grant County. In case you didn't know, Grant County is an area full of ridges, not mountains, not the size of terrain that you guys have here, but it does have some similar characteristics. So we're not too far away from what happens in Southeast Kentucky, very rural communities. A lot of folks living unhealthy lifestyles just because they don't have access, they don't have the funds to do things. So we're very comparable in terms of what's going on in our community as compared to here. So one of the things that we're very proud of is that we started 20 years ago. It began with some school nurses realizing that the obesity rates in our community were not just bad, but they were the worst in the state. And that sort of initiation began with those folks getting together and talking about how to solve what they saw as a crisis. And so 20 years ago, folks started to gather and meet and start talking about how do we solve this problem. So that's kind of our origin and our roots. Our goals that are derived from those initial meetings, trying to focus on improving our health outcomes, increasing physical activity, increasing healthy eating, and obviously smoke-free environments. So those are the kind of primary focus that we have. And we've done that through a variety of programs over the years. Some programs that frankly were wonderful, got started, and then they failed One of those, unfortunately for me, was the one here listed, Explore the Mud Run. Loved that. It was one of my favorite events. The last time we had it, I was able to bring my granddaughter, and she went with us at the age of 8. She had a blast. But it didn't pan out. It just didn't work, right? I mean, after so many years, people just got tired of getting dirty, I guess. But we moved on, and we did other events. Get Out Fit is another stellar example of things that have continued on that have been successful over the years. Some of our most important activities, we have a 5K walk run that we sponsor every Derby Day. So that has continued on for the past 20 years. Then we do something called Biggest Winner. I'm sure everybody's heard of Biggest Loser. Well, we do Biggest Winner. And this is a program where we've partnered with different groups in the community. We've got Zumba classes that you can take for free. We've got yoga classes that you can take for free to try things out. We have one local gym that allows for folks to come in and spend 30 days getting to know the facility and the staff and the people that are part of that group. And it really helps to get people motivated and try things that they wouldn't normally try, particularly something as difficult as going to the gym for the first time. So they do a lot of introductory things. We've done grants. Foundation for Healthy Kentucky actually has been pretty instrumental in some of those grants. So we've had things where we've increased sidewalks and walking paths at some of our elementary schools and in community areas. We built a splash park, which has been phenomenal. It's pretty simple. It's just a bunch of garden hoses attached to some fancy equipment. It sprays water and the kids love it. So we've had great success with that. We've also updated our tennis courts, which tragically is not being used as much as it should. I mean, people just don't think to play tennis. Again, it's one of these things where we've learned a lesson. People don't have access to tennis equipment. I mean, you got a great tennis court, but who can go out and afford to buy a tennis racket or the balls that are necessary and keep track of those things? So we've had to figure out ways to overcome those kind of activities. We do a lot with our schools. I think McKenzie's going to talk about some of the programs that we're also involved in. We worked with our school districts to increase kids' activities, not just during physical education time slots, but throughout the day. You can see some of our folks standing at a desk, which has become popular, as well as the little gizmo where you kind of pseudo bicycle ride while you're sitting at your desk there. And again, sidewalks have been very popular. And I think this is something that's probably the toughest, is changing policy. That is a slow and tedious process. Folks, in the government, in the local business community, that is a hard sell to get them to change policy. Shannon mentioned complete streets. I mean, that is such an important part of what we're about. And we'll talk about that a little bit here in just a moment. Obviously, tobacco-free school policy in schools, critical component. Vaping, of course, has now become the rage, and we're still trying to grapple with that little issue. So we'll talk more about that in just a moment. School wellness policy kind of refers back to some of the slide there before where we showed kids using the standing desk. Complete street policies, we've been pretty fortunate that most of our cities in our county have adopted complete street policy. And this is where partnership has become so key for us. The Northern Kentucky Health Department is just outstanding. I can't say enough good things about the folks who work at the Northern Kentucky Health Department. They helped us push forward with these complete street policies. I mean, in our community, like many, transportation and design of transportation systems is pretty awful. I mean, we have little islands all up and down US 25 of neighborhoods that don't connect to each other. They could, but nobody thought to do that. And so if you want to ride your bike from one little neighborhood to the next neighborhood, you've got to go out on US 25, which is, a two-lane highway at 55 miles an hour. Not exactly ideal walking or bicycling. So what we saw, and I wish I had a slide for this, we see a lot of kids walking up and down the railroad track, which runs parallel to US 25. Well, there's a safe, viable alternative to transportation, right? So we've been trying to push for more sidewalks that connect our subdivisions and our small communities together. So we've managed to do some of that, and we'll talk about that as well here. Smoke-free environments, I don't even know how to begin to describe the amount of effort that has gone into helping change the policy in our little community. We are the southernmost northern county in northern Kentucky. So Grant is just below Kenton, Boone, and Campbell. And that's the river communities. And those folks who are more advanced, more educated, more engaged in health outcomes still haven't passed a smoke-free policy. Little Williamstown, Kentucky, though, was able to manage that. And one of the key ways that we did that is we had a mayor, Mayor Skinner, who actually was supposed to be here today. I'm his substitute fill-in for him. He had something else going on. But he was a champion for this as well. He also was a firm believer and supporter of our efforts. And he helped us talk to the city council in trying to convey to them the importance of smoke-free environments, for our kids, for the workers, and for the folks that, don't really want to inhale secondhand smoke. So a little quick story here. One of the key players in this decision on the city council, he's a local contractor, general contractor, as well as operates dump trucks, and he delivers gravel all over the community. He's delivered gravel to my house. And one of his big issues is he didn't like people smoking inside of his vehicles, because when he gets in one of his dump trucks, he doesn't want it to smell like cigarette smoke. So he was a key player in figuring out how to pass that legislation. So that's kind of an example of like the level of detail you have to get to. You have to find those little nuggets of information that help you move forward with some of the policies that are absolutely critical to improving the health outcomes in your community. A little bit more about that. As I mentioned, we do a lot with our youth. I just recently visited one of our middle schools, and there's a group called Champions for Drug-Free Community, and they have a little group of folks who gather to talk about how to improve their own existence. And these are youngsters that are passionate about trying to be engaged in improving their own lives. So I got to sit down with them, and they told me what they wanted to see in terms of improvements to our local park. And so we got together with some of our other folks that we work closely with, and we created a little bit of a fund there to help build some exercise equipment at the local park. So it's kind of nice to get into the heads of your youngsters that I see out here in the audience. So I appreciate you guys being here today. So speak up. We need to hear from you. So what's next? We are definitely doing as many things as possible, but we're a small group. I mean, we have roughly 20 active participants in our group. We meet once a month. We have different programs that we're engaged with, but we continually, try to plan and strategize. You can't change policy without having a good plan, a good strategy, as I mentioned earlier, with the smoke-free environment. The biggest project that we have going on right now is the trail that we're building. We just received a $2 million grant to build a 10-mile section of a 42-mile trail that will go from the northern part of the county all the way to the southern part of the county. So we're super excited about that. But it took a lot of effort. It literally, that was something we talked about 20 years ago when we first started our group, is that we really don't have enough sidewalks. We don't have enough access to get to the parks and things. So we're connecting all these important infrastructures throughout the community with this trail. And like I mentioned before, we probably share a lot of characteristics with Southeast Kentucky in terms of our health rankings and our health profile. All that red is probably not good on the screen there. And that's pretty much it.
So Tim, talk about, so thank you very much. And so what you heard is a small group of Grant Countyans who got together, formed a coalition around improving access, or what we also can talk about, built environment for health. So Tim, talk about, 20 years ago, and the accomplishments that you've done so far. Who were the early invitees to the table? Who did you need to come in to start this conversation?
Right. As I mentioned, the school nurses were key, but of course, who do they report to? Superintendents. Very important to have those folks at the table. Driving anything in our community, it centers around education. I mean, that's the biggest employer, that's the largest group of folks gathered in any one spot. It's all going to be centered around education. So that was the core, that was the starting point. And then we realized quickly that obviously we got to have the business community, we've got to have the local government community, and the county government. And so we've been pretty fortunate that we've been able to find, not in sort of a organized plan, but we've been able to find those champions. Mayor Skinner as a prime example of somebody who was passionate about health and improving the community. You know, he was former chair of the organization that I'm part of. And so he, you know, as an individual, had quite a bit of influence, not just in you know, Williamstown where he was mayor, but because of his name and his recognition and what he stood for, he influenced the county executives to also think harder about some of the activities that we were engaged in and get us some support that we really needed.
Thank you. And thinking about, you know, I hope you heard the ridges of Grant County, and like there's not a lot of sidewalks, and so it's not quite as mountainous as Appalachia, Kentucky, but it's plenty of hills and not a lot of sidewalks and curvy roads. When you talk about building the sidewalks or the walking trails or the paths, the ones that you have been successful with, are people using them?
Good question. So we do a survey and actually go out and check. And so I've spent many an hour at an observation post watching to see how many people use a sidewalk over the course of an afternoon or on a Saturday morning. So yeah, we do check to make sure that, you know, the money that we've invested actually has some actual outcome that we can be proud of.
So it really is, you know, envision, share your vision, and it is really, if you build it, they will come concept.
I think it's a little bit more complicated than that, because
Okay.
I mean, we have obviously built some things that did not get used as much as we thought they would. And so it's a little bit of a marketing strategy as well that's needed. I mean, you've got to make sure that people know that things are there for them, because everybody's busy, everybody's got things going on. And so it's real easy to drive down the same road that you've driven down your whole life and never notice that there's a new sidewalk. I'm guilty of it myself. You know, it took me about 3 months driving down the same road to figure out, oh yeah, we did finish that sidewalk, and see that actually people are walking. And sadly, it was to connect some, you know, community, you know, areas to a school. And it's like, how do we not have sidewalks that connect subdivisions and residential areas to our schools? I mean, you cannot walk to hardly any school from any of the residential areas in our community. And so building that is just a foundational piece.
Building it and then letting people know it exists.
And grants. That's the starting point for everything that we do, because we don't have a lot of money. So that's been key.
Okay, fantastic. We'll move on to our last panelist, last but not least, McKenzie Fox-Potter, who is our Kentucky Horticulture Council project manager. She's going to talk to us about farm to school, how we get healthy foods to schools.
Yeah, thanks. Thanks. So my name is McKenzie Fox-Potter. I'm really honored to be here to speak today, and I work for the Kentucky Horticulture Council. We are a founding member of the Kentucky Farm to School Network, which I'll talk about in a little bit. But today I'm here to talk to you all about Farm to School, which you may have heard of before, but if not, I wanted to give you just a little bit of a preview of what Farm to School is. So Farm to School connects students with where their food comes from and the farmers that grow and produce that food. And it does that in a comprehensive, all-encompassing way. There's 3 main components of Farm to School. The first being local procurement, so serving local food in the cafeteria. The second being nutrition and agriculture education in the classroom. And the last being the hands-on component that gets kids super excited about fresh fruits and vegetables, which is school gardens. And as I mentioned before, we are a founding member of the Kentucky Farm to School Network. The Farm to School Network was established in early 2021, which is not that long ago, but Farm to School has been around in Kentucky for a very long time, for about 20 years. I think the earliest Farm to School efforts that I've been able to track down were from about 2001. But the most Farm to School efforts have really taken place in the last 10 years. And so the Farm to School Network just seeks to elevate all of those efforts and coordinate. And so we're a coalition of organizations, agencies, and individuals that are passionate about farm to school in Kentucky and do efforts to help elevate the efforts that are already happening and start new programs. And what really makes our work possible is our many partners. So I feel so lucky to work with so many great people, some of which I'll mention today, that help make farm to school possible in our state. And so when we talk about why farm to school is important, we say that kids win, farmers win, and communities win. And we say that because kids have access to healthy fruits and vegetables and local food in their cafeteria. And they're also learning about where their food comes from, which is a pretty critical component to healthy lifestyles. Farmers win because they have an extra market to sell their product to, which is great, and that contributes to their financial stability and success as a farmer. And we say communities win because that money is staying in the local economy and is hopefully contributing to healthier communities in the long run. And so there were a couple of health components that I wanted to highlight. One being that farm to school efforts have actually shown to increase preference and intake of fruits and vegetables, which is really key to a healthy body. And that effect does not just happen with our students. It has actually been shown that farm to school efforts have positive changes in our educators' diets and lifestyles. So just bringing farm to school to light in a school can not only impact the kids and help them be healthier, it can also help the adults that are working in that school. And so some of this we've talked about already, which was a really good setup to what I was talking about today. But obesity rates are at a high in Kentucky, and childhood obesity especially is at nearly 25%, which is pretty alarming and shows that we really need to do something about that. But part of that is due to the fact that less than a fourth of our 10 to 17-year-old children are reporting that they're eating their recommended amount of fruits every day, and less than a tenth, yes, 1/10 of our kids are eating the recommended amount of vegetables. And we know how important fruits and vegetables are to a healthy diet. So part of farm to school is increasing access to fruits and vegetables that kids like and enjoy, and hopefully to increase those numbers so that more kids are consuming the amount that they should be. And schools are uniquely positioned to address these concerns because the average Kentucky student eats 1 out of 5 of their meals in a school or from a school. And for our most vulnerable students, that number is 1 out of 3. So that's pretty significant when you think about how many meals our kids are eating at school. And just to add to that, over 90% of our Kentucky public schools are eligible or near eligible for the Community Eligibility Provision Program, which means that they can serve free meals to all students. And so, like I said before, our schools are really uniquely positioned to help address some of the health issues in our state. And our farmers are prepared to do that. So there's a strong agriculture economy in Kentucky with over 75,000 farms. Our farmers grow everything from fruits and vegetables to meat and dairy. And so our farmers are willing and ready to help supply food to our kids. And so I wanted to highlight a couple of the activities that the Farm to School Network has been working on for the past 1.5 to 2 years. I'm going to go through some of these slides kind of quickly just because we're limited on time, but I could talk about Farm to School truly probably the entire day. So feel free to come and see me at our Kentucky Horticulture Council booth if you want to talk more about it because, yeah, I'm really passionate about it and I would love to talk with you more about it. But one of the efforts that we've done is the Kentucky Farm to School Challenge. And we started that was our first initiative that we did as a group. And we did that during the 21 to 22 school year and had participation from 60 schools. And the challenge was just a way to gateway schools to participating in Farm to School. It was a really low barrier. They just had to complete one activity in each of the 3 areas of Farm to School that I talked about a couple minutes ago. And currently in this school year, we're actually at 59 schools. And these are just some pictures of kids participating in the Farm to School Challenge in the 21 to 22 school year. And then the project that I'm really excited to talk to you guys about today is our school garden and nutrition education pilot project. And so we were able to get a grant, talking about how important grants are, right? We were able to get a grant from the National Institute of Food and Ag last year. And part of that project is working with 5 Kentucky schools, 4 of which are actually in the SOAR region, to do school gardens and specifically really target that nutrition and cooking education. And so we were able to give away 5 $5,000 grants, and $1,000 of that the schools had to spend on nutrition and cooking supplies. So we really think that that's an important piece of kids learning about where their food comes from and addressing some of these health issues. And to add to that, we were able to hire a couple University of Kentucky interns from the Department of Nutrition and Dietetics that are working with these schools. So they're not totally off there on their own. For about 2 years, they have access to these UK interns, and our students are currently doing a 5-week nutrition pilot project in the schools to see if doing some education around the school gardens and tying that to cooking has an impact on kids' eating habits. And so we'll be excited to share the results of that research probably next year. And I just wanted to highlight really quickly 2 of the schools that are within this project, one being WB Muncie Elementary, and they're in Leslie County, so it's not terribly far from here. And I think what makes their project especially unique is that they have an indoor and an outdoor garden. So you can see there on the left, that is a hydroponic tower garden. And they are a really great resource for schools because you can grow in them year round. And then on the right there, you can see their raised beds. And I'd also like to point out that this school's project is led by their family resource staff. So that's a really great way to do farm to school efforts as well, is to involve people outside of just the teachers, because we all know teachers have already plenty of going on. And then the other school I wanted to highlight is Kingston Elementary in Madison County. And I think what makes their project really unique is that there are many teachers that lead this project, and it's cross-curricular. So teachers from all different ages and subjects are participating in the garden, taking their kids out there, doing special projects. And that's really awesome. And then they also have an after-school garden club that they're doing once a week for the kids, and that's for K through 5th grade students. And one of my favorite pictures I've ever taken is up there, that picture on the far right. This was not staged at all. This little kid ran up to me and was telling me about how the tomato was so big, he'd never seen a tomato that big. And I happened to capture a picture at the perfect moment, because this is what it's all about. This is what I love to see, is kids getting excited about eating healthy local food. And if we go to the next slide. Another one of our projects that we're working on right now, thanks to funding from NIFA, is our Taste Test mini grants. So we were just recently able to award 40 $1,000 mini grants to Kentucky schools, farms, or community partners to conduct taste testing activities in schools of Kentucky grown fruits and vegetables. And this is just another way to get kids excited about eating fruits and vegetables and give them the opportunity to try it without any sort of repercussions if they don't like it. So we have, I think, 6 schools in the SOAR region that received that grant, including West Whitesburg Elementary in Letcher County and Highland Elementary in Johnson County. And then speaking of partners, the Foundation for a Healthy Kentucky was able to give us an extra $10,000 to award 10 more mini grants specifically directed at schools and communities that were affected by the 2022 floods. And so this is really exciting. We just launched that yesterday, and you can find that information on the Kentucky Horticulture Council website or either of our Facebook pages. And I just wanted to highlight a school that is doing local procurement, because I think sometimes we think that it's impossible to change the food that our kids are eating in schools, and it's not. It really, it is possible with some work and dedication. And so Williamsburg Independent School, I started working with them in the middle of the pandemic when they were doing entirely take-home meals, and they started purchasing locally grown food fairly quickly. And even with kids' take-home meals, they were serving kale salads, which was really awesome. And now they're doing just a whole variety of fruits and vegetables You can see there on the left that there are strawberries. We were cutting those up and freezing them for them to make smoothies with. And then on the far right, those are local tomatoes that they sent home during the pandemic. So it's not impossible. It might be a little bit harder than what you're conventionally used to, but with some dedication, you really can. It's totally possible. It's doable. And part of what makes this work possible is partnerships. So I am really blessed to work with the Farm to School Network, but I am just one of many, many people that work on these efforts. And it's all of us working together that makes it possible. All of these different funding streams, all of these different grants that we go after. One person cannot change the world, but a group of people surely can. And we hope to only elevate farm to school efforts even more in the future and bring more local fresh food to Kentucky kids, because our kids deserve it. They deserve access to healthy food. And our farmers deserve it too. Our farmers deserve for us to support them. And with that, that's all I have. My contact information is up there, as well as the Farm to School Network Gmail, which a variety of us check. So please feel free to reach out to me if you want to discuss Farm to School. You can also follow our Facebook pages or come talk to me at our booth anytime in the next 2 days. So thank you for having me.
Absolutely. That's an open invitation for McKenzie to get to see that at our booth and get some more information about actually how to implement this. And so, McKenzie, I want to ask you a quick question in regards to getting more schools to participate. We've got a group out here that are very active in their community. They're interested in health. What would be a step that they need to take to, number one, find out if farm to school exists in their schools, and then if not, what's the first step?
Yeah, so I think a lot of people are overwhelmed by the prospect of doing local food in schools, but it doesn't have to be a big first step. It can be a little step towards maybe doing, with our taste testing grants, you can serve some local food and do a taste test, or you can do the Farm to School Challenge. Any of those things are a really great way to start. And if you're unsure if your school does Farm to School, you can talk to the school cafeteria manager or the principal. And if you don't, then convince them to do it. There's plenty of people out there that are here to support you and help with farm to school efforts. So if it's something that you think is really great and you want to see it in your schools, you can make it happen. And also, we've talked about this already, but funding is really critical. I think that during the pandemic, we saw that our food service staff are maybe not as appreciated as they should be. They were out there feeding kids in the middle of the pandemic when everybody else was staying home. And if we want them to do this extra effort, we need to put our money where our mouth is. And whether that's some sort of state funding or national funding, we need to support our school staff in order to do that.
Thank you so much. And thank you to my panelists and to the audience. I know we need to wrap up, but just the take-home messages today is talking about how you have a vision, you create the change you want to see in your community, you be the change, and finding out who are the partners to bring to the table. And so we heard about community access. We heard about policy change. We heard two opportunities or two best practices of getting involved and making things happen, being that mover and shaker. So the challenge is going back to your community with this information and finding out where you can make those policy changes at the state, where you can get involved at the state, the local, and the institutional level to support and reduce poverty and to build accesses to easy physical activity opportunities. With that, thank you so much for the panel and to our sponsors, and stick around for the next event and have a good afternoon.